I hereby declare the Candioi County Board of Commissioners special meeting now in session. I'd like to ask you all to please stand and say the Pledge of Allegiance to our flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone. Or good morning, good afternoon, everyone. What day is this? Yeah. I'd like to welcome you all here and your interest in Candioi County government. For your information, I have the agenda, and most people probably already heard the Supreme Court did block the OSHA requirements, and so that was the agenda item on the very end, and we are not going to deal with that today. And so we'll just proceed now with the regular agenda. We are not planning for any public comments today, but I would like to call at this time on Jenny Lippert, Candioi County Health and Human Services Director, and would you please give us a COVID update?
Good afternoon, members of the board and the public who is here and watching. Again, I am Jenny Lippert, the Health and Human Services Director here at Candioi County. So I'm going to be providing you a current Candioi County COVID-19 update as to where things are at. Just a second, I don't have the right, this is not. Okay, here we are. My apologies for that.
Okay.
As we know, viruses are constantly changing. So new variants of viruses, that's to be expected. We've seen it with influenza. That is what we're seeing with this COVID-19 pandemic. We started out talking about the Delta variant. Now we're talking about the Omicron variant. What we know is that the latest Minnesota cases are coming in, and we're calling this, from a public health term, community-wide spread. So that means that we have a lot of community transmission, and especially in the metro and us in greater Minnesota, that's what we're seeing. It's estimated that about 90% of the current COVID cases are likely attributed to that Omicron new variant that we're seeing. Increases in cases are right now here, and we're seeing those increases, but they're also likely to be very significant here in the next couple weeks, though we won't have probably complete case counts due to the readily available over-the-counter tests that now a lot of folks have access to, and also we'll probably see increasing hospitalizations to follow. The other concern that we have from public health is the healthcare capacity, the strains on the healthcare system that we're seeing, again, this new surge, this new wave of that Omicron variant, both for acute and long-term care settings. They're already stretched with staffing. This COVID situation, pandemic, has been going on for a long time. Those frontline workers have been dealing with this day in and day out, and here we are, how many months now, years later, and we're still having the same conversation. The Omicron wave is a result in, again, severe disease, even if the amount of Omicron that we see is less than the amount of transmission with the Delta variant. On top of COVID that we're seeing in our community, we're also seeing a really big rise in influenza cases, and that's primarily in those folks that are unvaccinated. Again, getting your flu shot every single year is very important. Illness, our healthcare workers, they're becoming ill themselves, again, adding to that strain in the healthcare system. Childcare facilities are experiencing the same thing with staff being out. That, again, attributes to our workforce and individuals not being able to go to work and further closures. So some statistics, this is real data for you. Current Candioi County total positive cases that we've seen of COVID-19, 10,939 cases. We unfortunately have seen 123 deaths due to COVID. And our current active cases, again, active cases are those individuals who are on their isolation and quarantine period currently with COVID, is 320. And again, I want to point out that that 320 is quite skewed because that doesn't take into effect those individuals who are testing at home and using those over-the-counter tests. We did not have access to that a year ago when we were having these same conversations, and now testing is more readily available. So that doesn't attribute to those folks that are testing at home. That does not get reported to the state unless somebody self-identifies and calls Minnesota Department of Health themselves. So as you can see, there's a graph at the bottom. You can see around Christmas time, we were at that 129 active cases. Fast forward now to today, January 13th, and we're at 320 cases. So it is definitely increasing and increasing at a significant rate. Vaccinations, that's been our big push from public health. That's a way that we can mitigate this COVID-19 pandemic. You can see statewide, 68% of our state's population has received at least one of the COVID-19 vaccines. 63.9% have completed the entire series. For us specifically in our county, we're at 55.8% have received one dose and 52.3% have completed the entire series. You can see the age groups. I know it's hard to see on my graph, but the age groups at the bottom, again, those over the age of 65, that's where we're seeing the most vaccination rates. Again, the vaccinations are newer for the younger children, but that's an area that we're trying to, again, get the word out and get the proper messaging for folks to get their kids and themselves vaccinated. I want to share this slide with you. It shows individuals who have 2 doses and how their antibodies are for a response to the original Delta variant and to now the new Omicron variant we're talking about, and how those individuals who have both first and second doses and a booster, they're 25 times more protected from this new Omicron variant. I have heard statistics that unvaccinated folks are 17 times more likely to end up needing hospital level of care. And those who are vaccinated, even though they might end up with COVID and get reinfections, their symptoms are mild to none and they're not needing that hospital level of care. So some mitigation tools, these have not changed throughout our whole conversation throughout this COVID-19 pandemic. We really strongly believe in getting vaccinated, and now again, that push for getting your booster dose. If you're feeling unwell, please stay home. If you've been exposed to COVID-19 and have symptoms, please get tested. Wear a medical grade mask in public areas or a mask that's double layered, you can't see through it. Again, a mask in public areas and when you're around others. Avoid crowded areas, large gatherings, and then again, with everything, practice good hand hygiene. So again, just a reminder, there's 3 COVID-19 vaccinations that are available. The Pfizer vaccine, that's a 2-dose series with an approved booster. The Moderna vaccine is a 2-dose series with approved booster. And the Johnson & Johnson, which is a 1-dose series with an approved booster. So there have been recent changes to the boosters. Anybody who has received the Pfizer or Moderna vaccine and they've completed their 2-dose series, they're eligible for a booster 5 months after that second dose. And with Johnson & Johnson, it's 2 months after your 1 dose that then you're eligible for the booster. Reminder, like I said in the beginning, influenza is hitting our community hard as well. So if you have not gotten your flu shot, it's not too late, and still that's highly recommended by our healthcare providers. You might have heard some changes recently from the Minnesota Department of Health and the CDC on masking. They are recommending, due to the changes of the Omicron variant and some things they're seeing with it being highly more contagious and easier to spread between others, they're recommending a high-quality surgical mask. For the general public, a surgical mask, I don't know if the camera can see me, but it's the blue disposable masks. That is considered a surgical mask. If folks have capacity to get some type of KN95, or if they've been properly fit tested for an N95 respirator, that is what they're also recommending. But again, I think, as we've said throughout COVID, any mask is better than no mask. But if you are going to use a cloth mask, make sure you hold it up to the light and you don't see any holes coming through it, or double masking. That's something they're talking about as well. Make sure that your mask fits snug on your face, that you don't have large openings. Even with the surgical mask, they're saying you might need to tie little loops around your ears to make it fit snug, and also press down on the bridge of your nose. Testing options. So locally, testing is available through Walgreens Pharmacy, Caris Health, CentraCare in Painesville, and then also our state does offer free testing. It's an at-home kit that gets mailed to you, and you're able to send it back in for results. And I have heard there's a number of over-the-counter tests as well, and those are just fine to use. There have been some changes to the isolation and quarantine guidance. So it used to be 10 days that you had to stay home if you've been COVID positive. Now that has shortened to 5 days. So again, that came out from the CDC, and now MDH has adopted that as well recently this week. So what are some adverse outcomes if we kind of continue going about things the way that we currently are? What might we see in the coming weeks? We're hearing from our healthcare system. We at Public Health have weekly calls, sometimes even more frequent than weekly, with Caris Health administration and nursing staff. They're telling us that they're already burdened. They're telling us that there could be a potential that there's no hospital bed availability. There could be no access to care for those individuals who aren't needing to seek treatment due to COVID, but have slipped and fallen on the ice and need something, or have a heart attack. So they're really asking us to try to help them to mitigate this current situation so it doesn't get worse. Also, workforce issues. Again, whether it's the schools, whether it's local businesses, childcare closures, that all has a ripple effect. The more people that are out due to illness then can't continue assisting our general workforce. I always want to remind everyone to stay up to date on current and also reliable information. There's a lot of misinformation out there, a lot of myths. Make sure that you're finding your information on reliable sources. So great areas to check out, again, the Centers for Disease Control, the CDC, and also the Minnesota Department of Health. When in doubt, we here at Canada County Public Health are here to serve our entire community. You can always call us. We provide guidance. We can help answer questions, whatever it may be.
Okay. Thank you. Ms. Leopard, thank you very much. You've done such an excellent job through this whole COVID thing for months, and public health, we're so proud of what Canada County Public Health is doing concerning this crisis we're in. At this point, any questions for Ms. Lippert from commissioners? Okay. I'd like to call on Administrator Kleindahl.
Mr. Chair, I did have some questions. Did you have any information available about regarding the hospitalization rates? You gave the infection rates, but the hospitalization, you didn't have, okay.
No, I don't have that information. I can get it from locally here at Caris or the CentraCare wide, but I can get that for you.
Thank you.
Administrator Kleindahl, please proceed.
Mr. Chair, Commissioners, members of the public are here today, and those who are watching on TV, thank you for being here. The county board and myself had a call last week with CenterCare regarding a lot of the numbers that Ms. Lippert just got done covering. And their ask right now is that because of the peak in the virus right now, that they need action immediately to try to slow it down. And what they're asking is that, people still get vaccinated and get their boosters, but that won't be quick enough. Because the virus right now is acting so quickly, they're saying we need the mask. In order to slow down the sick out, they're requesting the public to wear masks. We can only control what we have. And so what we would like to do, or I'd like to recommend to the county board, is for our county buildings, the county buildings that we have, is that we go to a mask required when you're in our common areas, in our buildings. And I would like to have that effective tomorrow, and we will review it on March 1st.
Commissioners, any questions, comments?
I have
Commissioner
one.
Anderson.
So you're saying just county buildings
Yes,
and only in common areas?
Yes.
So if like county employee goes to his office or to his cubicle or whatever, he doesn't necessarily have to wear a mask, correct?
Correct.
Okay.
it's like, I'm sorry, Mr. Chair.
Please proceed.
If you're in a hall, you're coming in the building, you're in the hallway, you're walking in the restroom, or you're walking to the dining room, while you're walking in those common areas, you'd have to have a mask on. You sit down to eat, you could take your mask off.
Okay.
Mr. Chair.
Commissioner Mdek.
And that's for anybody entering the building, not just county employees, correct?
Mr. Chair, that is correct.
There's a current sign outside, if you've been vaccinated, you don't, they ask you to use good judgment. What's wrong with that?
Right now, what the medical professionals are saying is that because of this virus, the Omicron virus, anybody can be a carrier and spreading it. And so to slow down the spread, they're asking everybody to, whether you're vaccinated or not. I'm not a medical professional. I'm just repeating what the ask has been.
We have heard that song before, 2 years ago, 2 weeks to slow the spread. So if you've had the disease and had the shots, I understand there is some, what do they call it? There's a term for someone who has my situation, getting it again, breakthrough. But I think it would encourage people just enough to just say, if you're unvaccinated or if you think you're not feeling well, wear a mask. That's my opinion. And then I will say one more thing, because all of a sudden, the masks that we're using aren't any good anymore. You got to go out and get an N95 mask. It just seems like they're moving the goalposts on us every time you turn around. And that's those I'll
Mr. Chair, I will just respond, as you recall what Ms. Lippert said, this viruses and stuff continue to mutate.
Yes. Any other commissioners? Commissioner Anderson.
Now, this is just a recommendation, right?
They're asking us, yes, they're asking us to have this. The only things we can control is our buildings. We're not saying anybody, any business, any schools, any churches. This is our buildings.
So it's basically the same as what we have now, isn't it? Where you have a sign outside asking to wear a mask.
Right, right.
So it's kind of a continuation of that?
No, but this is
I'm
required.
sorry, excuse me. Commissioner Mdek's next, then you will be.
Yeah, Commissioner Anderson, I think the change would be that it be required in our buildings in the common spaces by anybody entering our buildings, not
Correct.
recommended.
You're looking for a motion and approval. And Commissioner Nissen, please proceed.
No, I was going to make the same.
Oh, okay.
Mr. Chair, I would move to adopt that recommendation from our administrator about requiring masks in the public spaces in our buildings until, was it March 1st?
That's yeah, we have a board meeting on March 1st, and you can review it and decide what you would want to do on that date.
I have a motion. Commissioner,
Mr. Chair, I will second the motion.
and a second by Commissioner Gardner. Any further discussion? Commissioner
Yeah,
Evdeck?
thank you, Mr. Chair. I have many family members that are in the medical field, 2 daughters that are RNs. My mother was an RN. In October 15th of 1971, I fell down a silo and nearly cut the front half of my foot off. On the very day, this past October 15th, it was reported that there were no beds available at the Sauk Center Hospital on October 15th. Had that been this year, I don't know where my dad would have taken me that night. So
Yeah.
I have to support the medical staff that is fighting this battle.
I had the opportunity to listen to that WebEx that Ms. Lippert talked about, and they were discussing that they are rationing care right now. That's happening. I've also talked to an ambulance driver from one of the surrounding counties who was taking a patient to the ER, and before they got there, they said, "We're full of patients, keep driving." And this is very, very serious. And what we're worried about is they talk about a sick out, and that so many people are going to be so sick that we won't be able to get what we need. Businesses cannot operate if we lose that. Emergency services are going to be impacted. Healthcare, if you have right now, if you need some surgery, you're going to have to wait unless you're maybe having a heart attack or something. This is very, very serious, and we received a letter from 244 local regional doctors in support of doing something, and please mask for the next couple of weeks. And anything we can do to slow this process down, because this is the highest peak we've had since this COVID thing came along, and everybody's kind of just relaxed way back to normal. It's not. I think a lot of people hear that this new variant is not as serious. It is serious, and there's still Delta coming. And I'm just repeating information that I've heard from all those doctors, and I've heard from our own public health at this time. And that the mask, even though you have the vaccination and so forth, you can still carry it, you can still pass it on, even if you had a mild case and you don't even know it. And this way we can stop that peak and hopefully go back to a lot more normal thing in a few weeks. But Commissioner Gardner, please proceed.
Thank you, Mr. Chair. I completely get it. We are all so done with this virus. Unfortunately, this virus is not done with us. It's going to continue to mutate. It's going to continue to spread. And we need to take prudent precautions to protect our staff and our visitors here in our buildings. I would encourage the general public, the business community, and anyone else hearing this today, even if it's for just 2 weeks, mask up, be a little more cautious, and let's see if we can at least help our healthcare professionals get through this crisis that they are in, because if they are going to be in this crisis, we are all in this crisis.
Any other discussion, comments?
I
Commissioner Anderson.
Yeah, Mr. Chair. I know it's a serious issue. I've had a neighbor that passed away from it. I've also know a couple people that have been fully vaccinated, and they also contracted or whatever COVID after they were fully vaccinated, and they passed away. We're doing all these things, and I just don't know if any of this is really working. We were told last year, if we all get vaccinated, we can get back to normal by the 4th of July. And now we're right back to putting on masks again. And I understand that we want to try to do something, but I just don't know that any of this is really going to help.
Good, thank you. Commissioner Evdeck.
Thank you, Mr. Chair. And I understand, I think we all thought that the answer was get vaccinated and nobody would ever get this virus. In fact, I remember a lot of people saying, can you guarantee me I won't get it? Well, we were dealing with a brand-new virus that nobody knew anything about, which has mutated twice since then. And if you look at the hospitalization rates, you cannot deny the number of people that are getting sick. If you look at what Harris Health put out just a couple days ago, the number of people that are hospitalized, 75% of them are unvaccinated. If you go to Vegas, those are pretty damn good odds if you're going to get yourself vaccinated compared to not getting vaccinated. And so by being vaccinated and by taking some precautions, we can take the pressure off of our healthcare system right now until we get through this current surge, and hopefully we get nicer weather and we spend more time outside and we reduce the infections, and then the flu season hopefully has gone by us a little bit too. I think for now it's a small thing. We can't mandate it. We aren't mandating it for businesses and schools, but we can do our part here at the county.
Anybody else? Any other discussion, comments from the commissioners? Hearing none, I will call then for the vote on this resolution that we would mandate or we would require masks in our public areas, in our county buildings. And this will be in effect and will be reviewed at our first board meeting in March. Correct. I'll call for the vote. All in favor, say aye. Aye. Opposed, same sign.
Aye.
Mr. Chair, I'm going to ask for a roll call vote.
Okay, roll call. I'll start at the end of the table. Yes or no, Commissioner Gardner?
Commissioner Gardner votes aye.
Commissioner Nissen votes no.
Commissioner votes no. Commissioner Anderson?
I vote no.
Commissioner Emdek?
I vote aye.
And Commissioner Berg will also vote aye. The vote was 3-2 in favor. Thank you. Now, please
Mr.
proceed.
Chair, the next thing I have would like to discuss is we have a lot of public meeting rooms in this building, and we have a request for a lot of people outside of the county employees using the building, meeting rooms. And because of the increased numbers, one of the asks also from CentraCare was to limit the number of public meetings. And so I would like to ask the board to limit our public meeting use of our county health and human building until March 1st. And would only be for county employee meetings, or if we have a county board meeting or a city council meeting, they could use those rooms.
Mr. Chair, I would so move.
A motion by Commissioner Gardner, second.
I'll second that.
Second by Commissioner Emdek. Questions or comments?
Mr. Chair, I have a question.
Please proceed.
And I think this takes place after March 1st anyway, but just as an example, the Kennesaw Lake County Association of Townships has an annual meeting that they generally hold downstairs, and we're all a part of that as commissioners, or at least we're all invited. Were that to take place before March 1st, would that meeting not be allowed then under this?
If it's a county function, it would be. If it's a non-county function, it would not be.
Okay.
Do you have some examples of limiting, when you say limit the use of buildings?
So say, I'll use MnDOT for example. MnDOT has annual trainings where they want to use a multi-purpose room. During that period, they would not be allowed to. The Wilmer School District for testing for students oftentimes would use, they would not be allowed to do that during this year time. What we're doing is limiting the number of people that are coming into the building at any one time.
Any other questions of Mr. Kleinow? Sorry.
This is,
Commissioner Nissen, please proceed.
I know that you had a request for a political convention, and I don't know the date. What Paul would do? What, no?
March 26th.
Thank
March,
you.
that would be after March then. And by law, if you rent the building out, you have to allow people in. There is a law to that effect. I don't have that in front of me, but he has.
But we're not renting the meetings out right now. What I'm asking, Mr. Chair, is that during this year period, we would not be scheduling any meetings. It would be reviewed on March 1st. I don't know who's got meetings scheduled or not. I don't deal with that. That's
All
That's
right,
Karen,
that's
let Karen take
March
care of
1st is
that.
the,
I don't deal with those.
We'll talk after March
So,
1st.
so to me, it sounds like that meeting is scheduled
No,
after
it
the
was a
fact.
request was made.
I have a comment pertinent to this effect. In order for us to hold a convention, we have to have it out to the general public 30 days in advance, the location and time. That would not give me time to do that.
Okay.
Thus, it would take the convention out of the city of Homer possibly. It would also take the district convention
Okay.
for the 7th district out of Wellner also.
Okay, thank you.
But we can certainly check those
Thank you.
facilities in other towns.
I have no,
Commissioner, no more questions?
I gotta go to another meeting.
And the date would correspond,
I was just going to do it on March 1st, just
yeah,
to
with
keep
to be in line with the other one.
Again,
So,
Well, then, Mr. Chair,
Commissioner Anderson,
if we do this till March 1st, then they can still make reservations, can they not?
Mr. Chair, the only thing I would say is that they have to give a 30-day notice. I don't know on March 1st where the numbers will be. It could be expanded. So I understand the dilemma.
that is a dilemma. You are correct. My feeling by
So-
March 1st, if this continues to spike, I don't think anybody will be planning to having a meeting anyway, because it's that much of a crisis right now. Commissioner
Mr.
Gardner.
Chair, I would just suggest that this is probably an offline discussion between the public and staff.
Okay.
So, Mr.
Commissioner-
Chair, the motion on the floor is to restrict the use of the building until March 1st.
Correct.
And then reevaluate.
Commissioner Nissen?
But,
But it could affect
Well,
some,
but we can always reevaluate.
well, he
You know,
didn't say that in his motion, though.
but it could
I know
affect.
I didn't,
Okay.
All
so
right,
it's till March 1st.
Mr. Chair,
Please proceed.
you know, I'm trying to make this uniform so we can get things done, and also so we can let the people who are calling ask about the meeting rooms, okay? Granted, I'm sure there's some requests where they have to have certain timelines. The intent was to try to limit the number of people exposing our employees, the daycare downstairs. But if there's needs to be more discussion, if you want to table this until the 18th, our next board meeting, we could do that.
I feel it's an important issue that it's more important up front than later down. So by tabling it, we're missing the opportunity now we're really trying to address with this COVID wave peaking the way it is. We need to slow that down now and not just postpone it again. So I really think it's important that
But,
we
Mr.
deal with
Chair,
something along the way. Commissioner Amdak.
I think the question really is what do we do March 1st if we don't have improvements? Right?
And I don't know that.
Yeah.
Yeah. So we could still move forward to March 1st and have a conversation on March 18th about what do we do March 1st if the numbers have not been improved.
You mean February 18th? I mean, January 18th?
Or, yeah, our next board meeting, I'm sorry.
we could pass this motion and then reopen it. Could bring it up again in the next meeting.
The thing is for Karen to do her job, it's when, if she gets calls about who can use the rooms, and as spring comes, there gets to be more requests. And we could table it till the 18th, or we could change it. My only question, if you're going to change it, why just not wait?
Can I say something quick?
Good.
If you table it to the 18th, there is a meeting next week, Thursday, that it would affect, and that's gonna give them 2 days' notice of not being allowed in the building. That's the math now.
Right, but
So, I mean, there's 2 meetings in the next week or two here that
So the sooner we can give notice,
the sooner you give
I understand.
notice, I think it's gonna be,
okay.
Yeah.
I was just trying to give more time. I understand your situation.
Mr. Chair, I have a question.
Commissioner Emdek.
So would that space,
We can just,
the community room, would that be considered a public space and a requirement for face coverings
Yes.
while they were holding
We
the
would,
meeting?
we would make face coverings required in that space, yes.
For any meetings that would be held, whether we pass this
Yes,
motion or not?
it's a common area, public area.
Then I would move to table this this discussion. To January
I'll
18th.
second that.
A motion to table it, I got a second. All in favor, say aye.
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 Opposed, same sign. That's-
All right. Thank you, Mr. Chair. As you stated earlier, the next thing we were going to talk about is the OSHA COVID-19 mandate. As you know, the Supreme Court has put a halt on that ruling for now, and so we will not be discussing. But I just want to clarify those who are watching, that the OSHA mandate that we were going to possibly discuss because of the OSHA ruling was only for Canada County employees. It was never it's not intended for businesses, it wasn't intended for schools, it's not intended for churches, it's not intended for businesses. It was Canada County employees.
Our discussion, but the mandate was scheduled for any employer over 100 employees.
It,
Right.
it was for Canada County because we are an employer over 100.
I know. And but the discussion we were going to have was with Candioi County. I understand that.
Just us, yes.
But this mandate
Yeah,
would have covered.
but we have nothing to do with that.
Virginio, it would have.
Right, but we had nothing, I can only control what we have for
I'm
our
not
employees.
arguing with you there. I'm
Okay.
just clarifying it.
But
And by the way, I have another meeting, and I think we're at the end of this one. I'm not running away mad, I'm just going
know you're
away.
Thank you, Commissioner Nissen. Commissioner Emdek, please proceed.
Well, I was speaking to, or communicating with Ryan Erdman from the Association of Minnesota Counties.
Yeah.
It is not as clear and simple as the Supreme Court, because there was still a state mandate. And it is unclear at this point whether or not the Supreme Court's decision today also negates the state rule that we were operating under. And I would also add that to the point that Commissioner Nissen was making is that, yes, there is the OSHA rule did affect all businesses and all entities over 100 people. That is not our battle to fight or our decision to try to say it's wrong and it shouldn't be done. That is going to have to be in courts. And if people don't like that decision, they can't go to the county board and say, we don't want you to support the rule. We can't do that. We took an oath to uphold the law. And if it's the law, whether it's an agency rule or not, it's still a law, and we have to, we don't get to choose. We simply don't. Nor do the school districts, nor does any other business that is over 100. That part is moot right now. We'll see where the state one rule plays out. Likely it'll play out as the Supreme Court has indicated.
A very good point, Mr. Emdek, because we want the public to be clear that we do not set that kind of policy, or we don't do legislation, and you need to talk to your state and federal representatives about that kind of legislation that deals. We have to deal with what they decide, and it comes down to us. And as Mr. Emdek, we have to follow the rules and laws of our government. And Commissioner Gardner, do you have a question?
I do not.
Are you done, Mr. Kleindahl?
Thank you for today.
Nothing else? I just really want to thank everybody. I think we had a very good discussion, and the purpose of this meeting, this special meeting, was really to look at mitigating the COVID the best we can, and I think we want to do that. And I think the last statement I would like to make before I adjourn the meeting is to echo what we heard from our public health department and from everybody else, is that please get vaccinated. We don't want to mandate vaccinations, but if you can get a vaccination, it will make a difference. It will save lives. So please do that. And please be conscious of everybody else's health as well. We're a caring community. As a community, we can come together and do things and help each other out. It's not just about me, it's about everybody in our community. And let's work together to get a control of this COVID situation as much as possible. At this point then, I hereby adjourn the Candido County Board of Commissioners meeting.